Before I start the exam, I would perform hand hygiene outside the patient's room.
Come in.
Hi, Mr. Schaake. I'm Gia. I'm going to be your nurse today. We're going to be doing a head-to-toe assessment, which is basically just an overall picture of how your body is performing, and then we're going to do some more specific assessments as we go along. Before we get started, can I confirm your name and date of birth?
Brian Schaake, February 26, 1993.
Okay, and do you have any concerns before we start? Any areas you'd like me to focus on?
No.
Okay, great. So outside, before we stepped in, we got your height and weight. So you were 6'2" and 270. We also tested your vision outside with a Snellen chart, and your vision tested 20/20, which is great.
Cool.
So just by looking at the patient is dressed appropriately for the season, makes appropriate eye contact, his skin color appears appropriate for age and race, his hair looks appropriate for age, and overall he does not seem to be in any distress, and the patient also reports that he's not in any distress. Okay, Mr. Schaake, I'm going to ask, do you know where you are today?
At the doctor's office.
Okay. And what year is it?
2020.
Great. And who is the president?
Donald Trump.
Okay. So a patient is oriented to person, place, time, and overall oriented. So he is ANO times 4. Okay, so I'm just going to generally inspect, this is getting started with the head. So we're just looking at the head. He doesn't have any notable lesions or bumps or drainage coming from any orifices. Patient appears to be calm. Okay. Now I'm going to have you do a couple of face movements for me. I'm going to have you smile. Smile with teeth. Stick out your tongue. Good. And puff out your cheeks. Alright, good. So cranial nerve 7 is intact. And squint your eyes. Good. Okay. Now I'm just going to use my hands and we're going to palpate through your hair and various parts above your head. Let me know if there's any pain while I'm doing any of this.
Okay.
So I'm just sifting through his hair, parting it back gently. While I'm doing this, I notice his skull is symmetric, no obvious bumps. I do not feel any fissures, and I also do not see any infestations. The hair is full, thick, brown, and shiny, well maintained, and the patient has good hygiene. Okay, now I'm just going to palpate on your face. I'm palpating your maxillary sinus here. Do you have any pain here?
No.
And now your frontal.
No.
Okay, and now I'm going to move to your jaw, temporomandibular. I'm going to have you open and close, open and close. Any pain with this?
Nope.
I don't feel any locking or popping. Good. All right. So now we're going to test some of your sensory function.
Sure.
So I'm going to take this little wisp and I'm going to have you close your eyes and you're going to tell me when you feel this little wisp.
Okay. Yep. 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 Yep.
Okay. Great. You can open your eyes now. So cranial nerve 5 is intact with sensory. Okay, so now we're going to do kind of a more focused assessment on your eyes. I'm going to dim the lights for right now. Okay, so I'm just going to be shining this pen light into your eyes. You're going to look straight towards me, and I I'm going to be looking for your pupils to dilate and constrict on both sides.
Okay.
Okay? Good. Now the other side. Good. Okay. Now I'm just going to shine it here. Look straight at me, and I'm going to test your cranial reflex, or your corneal reflex. Good. Okay, I'm going to turn the lights back on. Alright, so the patient's pupils constrict and dilate to light appropriately, and it is consensual. He also, his corneal light reflex is also intact. So now we're going to assess some of your extraocular movements. Alright, so I'm just going to have you follow the pen as I move towards your nose and towards mine, just with your eyes. Good, and keep following it. Good. Okay, one last test on your eyes. I'm going to have you cover your left eye. Okay, so we're going to test your peripheral vision. I'm going to wiggle my fingers, and when you see my wiggling fingers, just say now. Okay?
Mm-hmm. No. 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 No.
Okay, now the other side.
No. 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 No.
Okay, great. So patient's cranial nerves 3, 4, and 6 are intact, as well as the optic nerve 2, cranial nerve 2. All right, so now we're going to take a more focused assessment on your nose. I'm just going to palpate up and down your nose. Good. Patient's nose is central, no lesions, no drainage. Any pain with this?
No.
Good. Now I'm just going to be looking up your nose. The patient's nares are intact. The nasal mucosa is pink and moist. Bilaterally, his nose hairs are appropriately scattered. And again, no lesions up on the turbinates. Okay, so now I'm going to have you cover one nostril and breathe in and breathe out. Good. Cover the other. Good. And out. Alright, the nostrils are patent and patient has good airflow bilaterally. Now we're going to be looking at your ears. I'm just going to shine a light in here. I'm able to visualize the tympanic membrane. It's gray and pearly. The pinna is soft and movable. The auricles are intact. There are no lesions or drainage. I'm going to check the other side. It's equally, the pinna is movable. The skin color is appropriate for race. The tympanic membrane is intact, pearly gray. And the auricles are also intact. So now we're just going to test your hearing. I'm going to have you wiggle your finger in one side, and I'm going to whisper something behind you. Okay?
Sorry, now?
I'm going to go behind you and whisper something.
Okay.
Okay. I love you.
Oh. Okay. You want me to repeat
And
that?
repeat what I said.
I love you.
Okay.
Other
And
side?
do it to the other side.
Santa Claus is coming to town.
Okay. So your cranial nerve 3 is intact. Or sorry, cranial nerve 1 is intact. Hearing feels pretty good. Alright, so now we're going to just look at your mouth. I'm going to have you open your mouth. Say ah. The palate is pink, moist. It quivers slightly when patient says ah. The tongue doesn't display any symptoms of thrush. Now make a big smiling cheese for me. Patient has good dental hygiene. Alright, now open your mouth once more. Stick out your tongue. Good. The uvula is midline. The tonsils are barely noticeable. Now I'm going to have you stick your tongue out and touch the roof of your mouth. Good.
Out or?
Just towards the roof of your tongue so I can see the veins underneath. They're present and no bulging or pulsations. Alright. Now one side of your mouth, stick it over here.
My tongue?
Your tongue. Good. Still no lesions on the other side. Buccal mucosa is bilaterally intact, dry or pink and moist, which is what we're looking for.
Cool.
Okay, so now we're just going to move on to your neck. I'm going to palpate around just to see if you have any pain. I don't feel any enlarged tonsils, which is great. I don't feel or see any JVTs. I'm feeling that his trachea is midline and the patient has no signs of goiter or deviated trachea. Any pain when I'm doing this?
No.
Okay. I'm just going to come behind you and I'm going to test, I'm going to feel for some of your lymph nodes.
Okay.
Just want to make sure you can see. Okay, so I am checking the pre-auricular, post-auricular, the tonsillar, the submaxillary, submental, posterior cervical, deep cervical, and supraclavicular. And I note no palpable lymph nodes. Okay, so now we're just going to do some range of motion activities. You're going to look and follow me. You're going to put your chin down to your chest. Look straight up. Look over to your right and to your left. Good. And touch one ear down to your shoulder. Good. And the other side. Good. Now we're going to do the same thing against resistance. So you're going to put your chin down to your chest. Resist, resist. Good. Same thing. Come up. Good. And look to this side. Sorry. One more time. There you go. And again. Good. And touch your ear to your shoulder. Good. And against my resistance. Good. So now you're going to shrug your shoulders up to your ears. Good. And relax. And this time against my resistance. Ooh, very good. Patient has full range of motion and strength is 5+. Very strong. Nice job, Mr. Schaake. All right. So now we're going to move on to the upper extremities. I'm just looking at skin color, again, appropriate for race. Hair distribution is normal for age. Looking again, no lesions. Good. Fingernails are well maintained. There are no seconds. Cap refill is less than 3 seconds. Bilaterally. Good. Okay, so I'm just going to have you raise your arms up above your head. Good. And down. And touch your back like this. Just do one at a time. Good. And relax and do the other. Good. And hold your hands out and flip your palms. Good. And all as far as you can go the other way. Good. Okay, so now I'm going to test your strength. So I'm going to have you, like you're doing a bicep curl. Don't let me pull your arm.
You ready?
I'm ready. Okay, good. Strength is a 5 out of 5. And other side. Good. 5 out of 5. Alright, so push. You're going to push against my hand. Push. Oh, good. Push. Good. Alright. So patient has full range of motion, internal, external rotation of the shoulders, full strength, bicep, triceps. And then before we move on, I'm just going to check the range of motion of your hands. Scrunch your hands for me. And extend your fingers as far as you can. Good. Patient has full range of motion of wrists and fingers. Okay, so now I'm just going to go to your back. I'm going to have lift up the back of your shirt. And we're just going to examine first. Alright, so here I'm specifically looking at skin color. If there's any suspicious lesions or nevi, you can sit straight. If he can hold himself erect, good. Patient has some tinea spots. Okay. We may want to watch this little mole right here, which is, I guess, this would be, I guess the third intercostal space, pretty midline on the spine, so we'll just watch that mole. I'm looking down here. Any pain when I'm palpating around here?
No.
Any stiffness?
No.
Any weakness?
No.
Okay. Alright, so now I'm going to have you take a big breath for me and relax. One more time. And relax. Okay, so patient has appropriate thoracic expansion. Now we're just going to listen for some breath sounds, okay?
Okay.
I'm going to have you breathe normally.
Alright.
And then I'll have you take some deep breaths.
Okay.
Take a deep breath. And again. Okay, you can relax. So the patient's bronchosvesicular and vesicular sounds, chest sounds are present. I do not hear any adventitious breath sounds. Okay, so now I'm going to have you lay down on your back, and we're assessment on your chest now. Okay. Just gonna lift up your gown. All right. So I'm looking at the patient's chest. It expands appropriately with breath movement. The patient does not seem to be short of breath. Again, skin is appropriate for race. Hair distribution is appropriate for gender and age. I'm looking to see if there's any pulsations, none of which I see. Okay, so now we're going to listen to some of your lung sounds on the front. And I'm going to have you take deep breaths as I'm doing this. Good. Okay, very good. So I was able to hear your bronchial breath sounds and bronchial vesicular and your vesicular sounds, none of which are adventitious. And before we move on, we're gonna move on to your cardiovascular health. So I'm just gonna palpate and feel for some pulses here. I'm feeling for your carotid artery, one at a time. The pulse is 2+, which is expected. I'm just going to listen for any bruits or hums. Okay, and I hear no bruits or hums with the bell side of my stethoscope. Now I'm just going to feel for some different pulses along your body. So I'm checking his brachial. They're present bilaterally. Your radial. They're present bilaterally, both 2+. Your popliteal. They're present bilaterally, although maybe a little weak. All right. Your posttibular. Which is present. And the dorsal pedal. Which is also present, and 2+. Okay, now let's take a more focused look at your heart. I'm going to have you lift up your shirt again. And we're going to listen to your breath sounds, or your heart sounds. Okay, so I'm just going to have you breathe normally. Starting with aortic. Pulmonic. Herbs. Tricuspid. And apical or PMI. Alright. I'm going to have you face towards me, roll onto your side. And I'm just going to do one more test with the bell of my stethoscope. Okay. Again, breathe normally. Okay, so you can lay back on your back. Alright, so I was able to hear your S1 and S2 sounds. There are no murmurs and no splits or pleural friction rubs or cardiovascular rubs, so that's great. So now I'm just going to do a focused assessment of your abdomen. Again, I see no distension or ascites. It doesn't look like there are any lesions, no excessive breathing, no pulsations. Okay, so before we do anything, we're going to auscultate for the bowel sounds. And Mr. Schaake, when was your last bowel movement?
2 hours ago.
Okay. So first I'm going to start in the lower right quadrant. Upper right. Upper left. And lower left. Okay, I'm going to switch to the bell and listen for venous hums in the epigastric area over the aorta. So bowel sounds are present in all 4 quadrants. I'm going to have you lift your shirt up again, Mr. Schaake, I'm sorry. And now we're just going to be palpating. So let me know if any of these movements or touch hurts. It shouldn't be painful though. No?
No.
Okay. Over here. I do not feel any enlargement of his spleen, which is good. His umbilicus is midline. His liver is present, but not enlarged. Okay, very good. Alright, so now we're going to look at his lower extremities. I'm going to have you lay here. There. Okay, So now I'm going to be looking at his legs, checking the temperature of his legs with the backs of my hands. The temperature is appropriate and skin is dry, tan and intact, appropriate for race, age. The hair on his legs is appropriate for his age and sex. I don't notice any edema. No edema. Okay, I'm just going to test his capillary refill on his toes. Less than 3 seconds on both so far. Good. Okay, so I'm going to have you scrunch your toes. Good, and full, and yep, flex your toes. Good, good. Now you're going to make circle movements with your ankles, one way and then the other. Okay, so now I'm going to have you push on the gas pedal against my hands. Good. And pull back on my hands. Good. Okay, so patient's range of motion in his toes is full, full range of motion. Strength in the toes and ankles is a 5+. All right, so now we're going to check your range or your strength of your legs. So I'm going to have you bend your left. Good. Okay, so I'm going to pull against your calf here, and you're going to resist my pulling. Ready?
Yep.
1, 2, 3. Good. Okay, now lower this one. And same with this one. 1, 2, 3. Good. Strength is bilaterally, 5 out of 5. Okay, so I'm just going to lift your leg up. Good. Out to the side. Good. Cross your ankles over each other. Good. And bend for me. All right, I'm just going to rotate your hip internally and externally. Good. So the left leg or the left hip has full range of motion and strength. We're going to try the right. Okay, inward, outward. Good, and cross your leg. Good, and out towards me. Good. Any pain or difficulty doing these?
No.
Great. So the patient's range of motion is full and strength is a 5 out of 5. All right. Now, Mr. Schaake, we're almost there. I'm going to have you stand up. Let's come. Okay, so now I'm going to have you stand on one leg for me. Good. Now, back down. Now, stand on the other leg. Good. All right, so now I'm going to have you relax. You're going to close your eyes, and we're going to perform the Romberg test.
Okay.
Patient is, it's okay.
Okay.
So you're supposed to do. Patient is not swaying. Do you feel unstable at all, Mr. Schaake?
No.
Okay, good. You can open your eyes now. All right, I'm just going to watch your walking and gait. So I'm going to have you walk a few steps just walk like you're normally walking. Good, and relax your arms coming back. Good. Okay, so his gait is normal and unaffected. Gait pattern is normal. The hips sway opposite from his arms. And the patient is not unstable when he is walking. Okay, so now I'm going to have you sit back down. Okay, so now I'm going to have you do a couple things. You're going to close your eyes, and you're going to tell me what this is in your hand.
All right.
Very good. You can open your eyes. All right, so now I'm going to have you take your hands. Okay, and then you're going to touch each fingertip to your thumb. And a little bit quicker. Okay, good. So patient is intact to stereognosis and fine motor skills. Now we're going to do rapid hand movements. So you're going to, on your knees, good. You're going to open, close, open, close, open, close. A little faster, as fast as you can. Good. All right. So patient's hand movements are appropriate. Now we're going to check your proprioception. I'm going to have you close your eyes. You're going to stick your hands out like you're an airplane. Point your fingers. Point your index finger. Good. And you're going to bring one finger to your nose. Good. And the other way. Good. And keep going. Good. And keep going. A little bit faster. All right. Great. And open your eyes and relax. Good. Okay, so that concludes our head-to-toe assessment. Do you have any questions or concerns with what we did today?
Am I healthy?
It appears so. We just want to watch, maybe let's refer you to a dermatologist for your tinea, and also have them take a look at this little mole back here on your back between
Awesome.
your scapula.
Okay.
Okay?
Very good.
All right. So at this moment, I would provide for patient privacy again by closing the door, allowing him to get dressed, perform hand hygiene, document my findings, and help him out. Thank you.